Hi everyone, I'm Keely Imla and I'm going to go over the treatment and prevention of botulism. One of the ways to treat foodborne botulism is to clear out the digestive system by inducing vomiting or by using medications to induce bowel movements to get the toxins moving out of the body. If foodborne botulism is caught early enough, the person can be injected with an antitoxin, which helps to reduce the chance of complications. The antitoxin attaches to the toxins in the bloodstream and keeps it from harming nerves. There is a different antitoxin called botulism immune globin used to treat botulism in infants. If wound botulism is contracted, there's a recommended course of antibiotics as a treatment. And if the wound botulism is severe enough, surgery may be required to remove the affected tissue. If needed, a person can be on breathing assistance for a few days to a few weeks since botulism affects breathing and swallowing, and some people may need rehabilitation after contracting botulism for speech, swallowing, and the effects of paralysis. To prevent botulism from ever happening, we need to start in the kitchen and be aware of the food we are opening and consuming. Home canning can be a source of foodborne botulism when a proper seal is not achieved. To make sure home canned goods are safe, always use proper canning techniques and processing times. For all foods, prepare and store food safely and don't eat anything if the container is bulging or if the food smells off or spoiled. It's better to toss a can of peaches or tomatoes than to risk getting botulism. This goes for all foods, not just home canned goods. Another big no-no is storing cooked potatoes at room temperature because it's not in the safety zone and it's a good environment for bacterial growth. Always store infused oils with garlic or other foods in the refrigerator and use them as quickly as possible to prevent the growth of botulism. It's also safer to buy infused oils rather than to make them at home. Never give honey to infants under 12 months of age. Even a teeny taste of it can introduce the botulism spores to an infant's body, and they can grow sporadically. And lastly, never inject or inhale street drugs.